Welcome to Paladin Financial Talk. I'm your host, Nikki Foley, and I'm really excited to kick off a brand new series that I think is going to be important for a lot of people listening today. So whether you're planning on your own future or you're helping a loved one, a parent, a spouse navigate aging, there's so many questions that, what kind of support is available? What does it cost? And most importantly, how are you going to actually pay for it? And so that is the spirit of where we're going with this new series. And so this is what we know. Aging is inevitable, but the confusion, the stress, and the financial surprises don't have to be. And so our goal over the next 4 weeks is to give you the education that you need to help take away some of the confusion, help give you the answers to some of these things. And then when the time is right and when you may be facing this, or maybe you have a neighbor, maybe you have somebody in your life that's going through this, give them this resource to make this available, to hopefully make this process simpler for yourself and for those around you. And so with that, let's just talk about why we're starting this conversation. Well, one of the biggest misconceptions that I hear over and over again is that Medicare can play a role in some of these expenses. And while that is true, they may play a role in some of the expenses. So many people assume that Medicare will cover all of the support that they need in this stage of life. And the reality is Medicare pays for something called skilled care. That is things like rehab after surgery, physical therapy, but when you have a medical need. What Medicare does not cover is something called non-skilled care. And that's often the thing that a lot of people need most. And so when we're talking about help with something called activities of daily living, so these are the things like meals, bathing, getting dressed, transportation, companionship, those are all activities of daily living. And that is what Medicare is not going to pay for. And this type of support, these things like this, these make a difference between staying at home, having somebody around you, and whether you are going to ultimately need some type of support. So if Medicare isn't going to pay for it, we need a plan for how you will pay for it. And let me tell you how we got here. So one, right now, we're getting ready to go into annual enrollment period for Medicare. So this is a really good time to take a step back and have a good understanding of what is happening with the policy that you have. So some people may just have original Medicare. Other people may have made the decision to supplement that or fill in the gap with an additional kind of insurance that typically comes in the form of a Medicare supplement or a Medicare Advantage. So no matter what you have or what you're preparing for, understanding at this time of year, taking time to look at this and know what it covers and what it doesn't cover is a really good step to take. But what I want to talk about in this series isn't necessarily just Medicare, it's the conversations that go around aging in general. So let me give you a little perspective. My brother, Matt Bryant, works with us here at Paladin Financial, and we were driving home to Kansas, and conversations came up about long-term care support and need. And when I say long-term care, I'm not talking about long-term care insurance. I'm talking about the practical need for care and what does that care look like? And so the conversation ran a wide range from somebody that is not going to be able to pay for care at all and may need Medicaid, or in Minnesota, it's known as medical assistance, to somebody that may be in a situation where they've been very responsible, they've worked hard to make a plan, but financially, the cost of care is very expensive. And so they may be able to cover half of what a care may look like, but there is a big gap that is in there. And so what is that going to look like? So as we were talking, my brain is going and I thought about who are the resources that we know that are in this community that play in this space that really have expertise in what this would look like in practical. We're not necessarily talking about financially, but the actual mechanics that go along with this. So with the introduction of this series, I want to invite some experts to join me over the next 3 weeks, and they are going to give us you kind of shed light on the puzzle that we're talking about here and each of the key pieces. And so first up, we're going to talk about the talk with the owner of a home health care company. She is absolutely amazing. She has so much energy and excitement for this space, and she actually got into it from a passion. It was something that hit very close to home with her as her grandparents were aging. It was during COVID, and it was enough to make her change careers and go into the home care, healthcare segment of the industry. And she is going to explain what non skilled care looks like, how families might know when it's time to bring somebody in, and the surprises that may come along with it. And so she's going to hopefully help educate us and make sure that we eliminate those surprises because we have some knowledge ahead of time that allows us to create that plan that's so important. And so the cost is often a key piece of that. And that certainly plays into the bigger financial picture that all of us are working towards. So can't wait to have Nicole Myrie of Griswold Home Care on with us next week. She is an amazing individual with what she is doing, the way she thinks about this, and how she's going to educate us on this topic of home health care and what, non-skilled care looks like and the tools available to us. From there, we're going to have a team with us that's going to talk about when you decide to be in a facility and what that might look like. So they'll break down what assisted living looks like. They'll break down what independent living versus nursing and when potentially memory care comes into play and where you might get that. Is it going to be in a single facility or will you have to be in a situation where you might move facilities? Who is going to pay for this? What does that look like? What are some of the practical things that you might run into as it relates to getting reimbursed from, say, a long-term care policy or something that you have in place to potentially pay for this? And so they're really going to get in the nitty-gritty of what are some of the actions that you can take today. How can you control things as much as possible ahead of time? Because we all know nobody plans to go into a facility, or they certainly hope that they don't have to. But the reality is one day mom and dad are at home and doing great, and the next day one of them falls and there's really no hope for them to go back home. It's just not possible to get the level of care that they need, and so they are now in a facility. And so what does that look like? What are some of the things that we need to know related to how being in a facility, the level of care that you might get, what the costs include, why it can sometimes be the best decision from a safety and a quality of life? While I know so many people want to age in place, these are the things, though, that we need to discuss and plan for ahead of time. And then finally, we're going to have a look at the elder law side of things. And so we're going to walk through the legal and financial planning side and how those things may interact with each other. Things like powers of attorney, protecting assets, what's the difference between Medicaid versus Medicare, and how avoiding the costly mistakes that some families have gone through. And we want to make sure we don't wait until it's too late. We have so many stories that we hear along the way here at Paladin Financial. And if we can bring light to some of the things ahead of time, again, everything seems to work out better when you have a plan and you've educated yourself. So between these three things, we feel like this will give us a good perspective on some of the things to start conversations about aging and what that might look like. But what I want to do today, just very quickly before we wrap up, as you know what's coming over the next few weeks, I do want to talk about Medicare at just a very high level so we make sure that we understand that. And as you go into annual enrollment season here, the annual enrollment period, some things that you might want to look for and make sure that you understand. And if you don't have an understanding of some of your options, that's where Paladin Insurance and the Paladin Financial team can come in and help make sure that you have an explanation with some of your questions. And so the more you know now, the less overwhelming it'll feel later on as you move through some of this. So let's start with clarity about what Medicare covers and what it doesn't. So terminology that you need to know is original Medicare, and that consists of Part A and Part B. What ends up happening is there's oftentimes a gap left in the expenses from original Medicare, and that scares people. That makes them nervous. And so people are looking for some type of insurance or assurance that they know what their medical expenses are going to be and what their biggest risks are from a cost perspective. And that's where Medicare Advantage or a Medicare supplement plan would come into play. And that goes along with that would also be prescription drug coverage, maybe dental, vision, or hearing plans to make sure that those gaps get covered. So I heard this from one of my dear colleagues, Judah Day, and he shared this previously on a show, but I'll rewind and share it with you again here. So the best way to think about what A and B cover is Part A gets you in the four walls of the hospital, and so it gets you in the door. Where Part B is all the things that you're going to interact with once you get inside of those four walls. So it's the doctors and it's the systems and the tools and all the pieces that go along with once you're inside the doors and within those four walls. It's such a good visual for me, and I know that I've used it a number of times to help with what Part A and Part B cover along the way. So let's talk a little bit though. Once you have original Medicare, and that's the first thing that you do is sign up for A and B, there are gaps that happen. So there are expenses that still exist, even though you have signed up for it and you do have original Medicare coverage. Those can be scary to people because they don't know what the bigger picture risk might be and what those expenses could be. So as an example, Part A deductible. So when you go into the hospital for something, let's say starting out with you have a knee injury and you go in for that, and you later find you have something very different that is a tumor on your neck, you have to pay a deductible each time that you have to go in for each incident there. And so who knows? Hopefully it's not a catastrophic year, but those can add up. And so people choose to have insurance of some sort that fills that gap. So Medicare Supplement, Medicare Advantage can play that role. With Medicare Advantage, those plans provide all the A and B, parts A and B benefits. They are offered by private companies approved by Medicare. And if you're enrolled in a Medicare Advantage plan, many Medicare services are covered by that plan and not paid by original Medicare. So that example of that Part A deductible that needs to be paid, that is absorbed with the Medicare Advantage plan. Now, there may be some copays and coinsurance that go along with it, but you have bought this insurance policy to assist you along the way with your medical expenses. Now, on the flip side, a Medicare supplement plan is a medical-only plan that doesn't include prescription drug coverage. You pair it, the Medicare supplement plan, oftentimes with a standalone prescription drug plan, and Medicare supplement plans pay for some of the costs original Medicare doesn't. So they work in conjunction with original Medicare. So things like copays, deductibles, coinsurance, that's where the Medicare supplement plan comes into play. And original Medicare remains your primary coverage, and the Medicare supplement plan is just that. It supplements or it's your secondary coverage. So there's a lot of moving parts that go with Medicare Advantage and Medicare Supplement, and we highly encourage you to work with a professional in this area to make sure that you truly understand. So often I meet with people and they share with me that they're already down the path. They've been on some type of plan for the last couple of years, and they say, I wish I would have known that there was additional options, or I only knew this one thing existed and I didn't know there was a whole universe of options out there. And so I highly encourage you to educate yourself using a representative from either, you can use medicare.gov as a starting point, or what I do all day, every day is I represent all the insurance companies that are, in the area. I don't represent all of them, but I represent 8 of them. And I have, 660 products that I can talk to you about. And so that I have a very broad perspective. Or call an insurance company directly and they will support you. So you have lots of options, but the key is start doing your research and make sure you really understand the dynamics of each one of the options that you have out there. Now, some of the other things that you want to know about Part A and Part B and where Medicare Advantage and Medicare Supplement come into play, knowing if your prescription drugs are included in your plan or you have to have a standalone one, that would be a key piece to know along the way. Knowing how it works in the state that you are in. Sometimes it feels like alphabet soup when Medicare comes into play. There's things like Plan F and Plan N and in all the different terminology. Again, I would just highly suggest partnering with a professional so that you know that you have an understanding of the concepts, you have an understanding of the lingo, you know what is applicable in your state and your area, and there's not confusion along the way. It's really important to know, where your costs might come in so you have a monthly premium potentially that goes along with things. And then there are things that original Medicare, uh, you know, that play into original Medicare and where those gaps might be. How are things like deductibles going to play into this? Max out-of-pocket expenses, things that are preventable versus immunizations versus things where diagnostic, things like durable medical equipment. Seems like terminology you might not have any idea what that means, but a CPAP machine is things that might be an example that falls under that category. What does urgent care look like? What's emergency care look like? What happens when you're going fishing in Canada? What does your plan cover? What does it not cover? What happens if you do an inpatient hospital stay versus out of patient? I mean, the list goes on and on. And so as we prepare for the next 4 weeks, I would highly encourage to make sure that you tune in. You let people know that these are the things that are coming over the next few episodes. So subscribe so you don't miss a single conversation. Share the series with a friend, a sibling, a parent who may be starting to think about these same questions. So next week, again, we'll kick off with our first guest, the owner of a home healthcare firm. We'll talk about how families decide when it's time to bring in support in the home, surprising things that may come along with how you pay for care. And in general, it's really timely to understand how Medicare plays a role against all of this, against the long-term care planning side of things versus the medical needs, skilled versus non-skilled care. Well, we're going to cover it all over the next 3 weeks with practical application with professionals within this area. So thanks so much for tuning in today. I look forward to sharing the series with you and helping you feel more prepared for what's ahead. Again, this is Nikki Foley with Paladin Financial Talk. We highly encourage you to go to paladinfinancial.com to continue finding out more about the services that we may offer along the way. And then follow us on social media and YouTube so that you can join in the series and join in the conversation, the education we're offering you. Thanks so much and have a great day. Paladinfinancial.com or call us at 651. And thanks for joining us.